I'm Shirley Moore, and in this episode, I'll be chatting to Cathie Cooper, a Macmillan breast cancer nurse specialist, and Tracy Pound, the breast screening nurse from the breast care unit based here at Medway Maritime Hospital, about Breast Cancer Awareness Month, which is October. So let's get going. October is Breast Cancer Awareness Month, and I'm honoured to be joined by two people, Macmillan breast cancer nurse and a breast screening nurse, who dedicate their time and energy and compassion to supporting patients through one of life's toughest journeys. And I'd like to introduce the two ladies. It's Cathie and Tracy. Good afternoon, ladies.
Good afternoon. Thank you, Shirley. My name's Cathie. I have been nursing now for just under 38 years, many of which have been here at Medway on and off for about 36 years. And I've been a breast cancer nurse specialist with Macmillan for 7 years, which I'm extremely proud of. Part of my role is to support patients through their cancer journey, not only physically, emotionally, and here to help them understand their diagnosis. The doctors use a lot of medical jargon, terminology, which is very difficult for patients to understand, especially when they're feeling very scared. So it's our job to break that down and give the patients a clearer understanding. We signpost patients to various support services, and it's really important that these patients have an informed choice so that they're well informed and can make good clinical decisions about their treatment. And we're here to act as a point of contact throughout patients, not only during their diagnosis, but usually for the next 5 years as they're kept under our care. So yeah, a very good role to have.
Well said, Cathie.
Thank you.
And Tracy, what's your role?
Okay, my name is Tracy. I've been a qualified nurse for over 30 years now. I've worked at Medway Hospital for 10 years, primarily in the breast unit. And I've worked as the breast screening nurse in the breast unit for the past 2 years. My main role is to manage and alleviate any anxiety experienced by women when they're recalled from their breast screening mammograms. I'm there to offer support before and during the assessment process, and I'm a contact while they're waiting for the results and prior to having an appointment with the consultant if they're diagnosed. And I'm there really to offer a personalised support while they're waiting for a diagnosis.
Wow, ladies, thank you ever so much. That's a lot to take in, if I'm very honest. Okay, so Cathie, why is Breast Cancer Awareness Month so important to you and your team?
October is a very important month. We're here to basically promote early detection. We need to increase the public's awareness of the importance of early detection, not only through the breast screening programme, but also through self-examination. It's about educating the public about the signs and symptoms, the risk factors, and looking at prevention strategies. What we're aiming to do is to empower the patient to be proactive about their own health, and it makes people more open about talking about breast cancer because it's a subject that no one wants to discuss, but we want to make it suitable for everyone to be open and honest about this diagnosis.
Thank you, Cathie. Trace, how is the National Breast Screening Programme? How is it so important, and what happens at the appointment if you get called back for a further assessment?
Thank you. The National Breast Screening Programme invites women from the ages of 50 to 70 for breast screening. Every 3 years they're invited. Ladies normally receive their first invite between the ages of 50 to 53. The ladies are invited to a mobile unit, and we've currently got mobile units in Gravesend, Swanley and the Isle of Sheppey. We also screen at Medway Hospital, so they can come to the hospital if that's easier for mobility or for transport. Our mobile units move to other areas within the Medway, Dartford and Swale area. And anyone who's registered with a GP and is within that age range will receive an appointment every 3 years. Ladies over 70 are not automatically invited for breast screening, but they are encouraged to continue to be screened every 3 years, and they can self-refer by phoning our breast screening service. During breast screening, the ladies will have 4 breast x-rays, 2 on each breast, The mammograms are done by a specialist called a mammographer, and that mammographer will be female. The mammographer will check your details and ask for any breast problems and explain what happens during the screening process. Once you've had your mammogram, you should receive your result within 2 to 3 weeks. And then when it comes to the assessment clinic, so what would happen then is the mammograms are then read by radiologists and radiographers. And if there is an issue or something that they want to investigate further, then you're invited to come back for an assessment clinic where we will receive and repeat some imaging, a mammogram, an ultrasound, and a clinical examination, and if necessary, take some more samples or a biopsy, if that's what we deem necessary.
That's a lot, isn't it?
It's a lot.
That is a lot,
Really.
a lot.
When cancer causes money worries, we're here. When you need to talk to someone who understands, we're here. And when you're worried about the future, we're here. At Macmillan Cancer Support, we're here for you. So that some days it's not all about cancer, it's about life. Call us on 0800 500 800 or visit macmillan.org.uk.
I have got two lovely people in the studio from Macmillan. I've got Cathie, a breast cancer awareness nurse, and Tracy, a screening nurse. Anyway, let's get back to the questions. Cathie, what are the most common myths and misconceptions regarding breast cancer?
There are many. So lots of people think that breast cancer will only affect elderly. And unfortunately, in certainly recent years, we are seeing patients being diagnosed at a younger age. So unfortunately, cancer knows no boundaries. So it doesn't pick on any particular age. And the myth about men who can't get breast cancer, again, that is also false. It is quite rare, but it does happen. And again, goes through similar treatment. For things that are surrounding us in daily lifestyle, underwire bras is not going to give you a breast cancer. Using a deodorant will also not give you a breast cancer. People who use their mobile phones or take sugar. There's lots of fad diets out here. So although we know that sugar isn't great for us, everything in moderation, of course, sugar is going to increase your weight, but there's no scientific evidence there that it will cause cancer. So we're looking at staying healthy. It's about your lifestyle choices. So we're promoting that you have a healthy weight and a balanced diet, limiting alcohol and try and exercise as much as you can.
Can I ask you a question, Cathie?
Please do.
Right. Okay. What you said about mobile phones. It's quite commonplace that a lot of ladies put their mobile phone inside their bra.
Yes.
Is that
a myth?
It is a myth, right?
Yeah.
Okay, because I genuinely, until you said that, believed that was true because I'm very conscious of not doing that.
Yeah.
Yeah. Okay, thank you.
There's no scientific evidence. It's over the years, things will change and evidence may show that in 20 or 30 years. But currently, there is no evidence to show that putting your mobile phone into your bra is going to cause a breast cancer.
Right, thank you for that.
No worries.
Tracy, how important is early detection?
Early detection is the most important thing that we can do. Cathie is going to talk in a moment about the signs and symptoms to look out for and how frequently we should all be checking our breasts. But if we find something, the earlier we find something, that's when it's most important that we detect something earlier. The earlier we detect something, the more chance we've got of a good treatment. An early stage, we can look for cancers that are too small for you to feel or see. And then your treatment should be simpler and likely to be more effective.
Is it a myth that lumps and bumps I think I was told that if it's painful, that's worse. No.
No, not always. Pain is not always effective. It can be painful, can not be painful, but it doesn't really, anything that's new or different or abnormal should be checked.
Yeah.
So whether it's pain, whether it's a lump, whether it's nodularity, whatever it may be, you should get it checked.
Just get it checked. Thank you. Sorry, Cathie.
I was just going to add to what Tracy was saying there. again, with breast screening, we would hope that 9 times out of 10, when we say to these ladies, could you feel this area of concern? We would want them to say, no, I couldn't feel anything.
Right.
Because if they had felt anything, hopefully they would have been to the GP and had that sorted. So that is, again, the beauty of the National Screening Programme, that it's highlighting cancers that patients can't feel themselves.
Yeah.
It's just the National Screening Programme is just so effective.
Cathie, what are the signs and symptoms to look out for, and how frequently should women and men check their breasts?
We recommend you pick a day in the month that is your regular day, whether it be the first, the middle, the last, whatever day is suitable for yourself. We would recommend using 3 fingers and starting at the top of your breast, if we say that's going to be the 12 o'clock position, and then go around the clock with that fingers, keep going round and around, and then working your way towards the nipple. Then looking at examining underneath the arm. When we examine, you would see a lot of people who lift up their arm to put their fingers under their arm. But actually what you need to do is keep your arm down to examine, because once you put your arm up in the air, it changes the anatomy of underneath the arm. So if there was anything there, it would actually be hidden. That's quite important when we're talking about that. So if we had a camera here, you would actually see Shirley lifting her arm up and down. So we're missing that. Changes to look for within the breast. We look for nipple inversion. Any changes to the nipple, any discharge coming from the nipple, obviously a new lump that can be felt, orange peel skin. So it will feel rough, and it literally does look like orange peel. Quite often you might see this if you were looking in the mirror. After you've had your shower and you've done your full examination, we do recommend also to stand in front of your mirror, pop your hands on your hips and do some clenching with your breasts, because that will, again, Shirley's doing that movement, again, that will change the anatomy and the shape of the breast, and you will see then any dimpling, indentation or the orange peel skin. Also to look for any redness, any rashes to the skin, any thickening as well. All of this, once you get used to it, this can take you 5 to 10 minutes. It's no longer than drying your hair. It's just part of your daily routine and will save lives.
It makes a lot of sense, Cathie, and I apologise that I was actually doing the move.
Yeah, no,
as you were
that's
talking,
good.
but no, it made sense because you're right. When you lift your arm up and put your arm down, when you got your arm down, you can feel a lot more.
Yeah.
Yes, thank you for that, and I'll practice. I
Please
promise.
do.
Tracy, can you explain what happens if you actually find anything abnormal?
Yeah, Cathie said about examining your breasts. Once you've examined your breasts, and if you notice anything abnormal, the most important thing to do is to not panic. And after that, to contact your GP. Once you get an appointment with your GP, the GP will examine you and will then make a decision about referring you to the breast unit. Once you receive to the breast unit, you receive an appointment, and then you'll be normally assessed in a clinic called a one-stop clinic. This is where you're initially seen by a breast doctor, a surgeon, who'll assess your breasts and get some history. And then they'll then send you for any appropriate imaging. That imaging could be a mammogram, a clinical examination where the radiologist will have a feel, and an ultrasound scan. Once they've done those 3 tests, they'll then make a decision. If they feel that you need any further tests or imaging, then they'll carry them out on the day. There is occasions where we may be seen by a breast doctor and then come back for imaging, but most of the time we try and get it done on the same day.
I find that part very reassuring because it never was like that.
No.
But now you've got, you could walk out and wait weeks and be quite worried. But now you walk out with the reassurance that you've been assessed.
Yeah, absolutely.
Yeah. And
It does
really,
mean you spend quite a long time in the breast unit waiting for all of these tests. But
I'd rather spend a long time in there and walk out and not know that you're okay.
But we highlight that on the letter,
Yes,
don't
we
we?
do,
That
yeah.
It will be a long appointment.
Yes.
Yeah.
And that's that we can try and get everything done
Yeah.
All in one visit.
Definitely. You're in and out of different rooms with different tests.
Yeah.
Yeah, perfect. Cathie, what help is available for anyone that is diagnosed with breast cancer?
So for anyone that's diagnosed with breast cancer, someone like myself or one of my colleagues will be present at the Breaking Bad News clinic with one of the surgical doctors. Our role is to offer you guidance, offer you support, emotional, practical and financial support with Macmillan. Each patient has a personalised care plan. So, even if we have 10 ladies that are diagnosed, they could all have a different treatment plan because it will all depend on what their results are. So some patients need further investigations before they can go forward with their treatment plan. So it's making the patient have a detailed understanding of what their treatment plan is going to be. We're there as a point of contact. We also refer patients not only to Macmillan, but also for Breast Cancer Now is another good support network as well. And then there are many charities that offer support as well. Copperfield, Look Good, Feel Good, the Harmony Trust. There's a new support group running in Medway that's called Booby Brunch. That's apparently quite successful as well. And also run by Breast Cancer Now is a course called Moving Forward. So lots of different support networks out there, and we're here to guide patients through them and do appropriate referrals.
That sounds amazing. Yeah, I like that last one. Was it Booby?
Booby Brunch.
Booby Brunch.
Yes. Yeah.
It's quite catchy, isn't it? Tracy, how many cancers are detected each year nationally and locally?
Okay.
Sorry, it's a bit of a question.
That's okay. So regarding to breast screening, as we were saying earlier, ladies come for a breast screening, they come for an assessment clinic. We do say that for every 100 people who have breast screening, 4 will normally be recalled for further tests. And out of those 4, only approximately 1 will be diagnosed with breast cancer. So within Medway, with the Medway, Swale, Dartford area, we invited 31,481 ladies for screening. Out of that, 7,963 women did not respond or did not attend screening. And that's something that I think we really want to highlight, just the importance of screening and how important screening is. What screening does is it detects breast cancers early. The earlier we detect something, the easier it is for us to treat it. So it's really, really important if you receive your breast screening appointment to give us a call and get an appointment so that we can assess you thoroughly.
I'm shocked.
Yeah.
I'm actually really shocked because it's so important, isn't it?
Yeah.
So
It's a
important.
high amount, isn't it?
Yeah, it's very high. Yeah, nationally, we've said that only 70% attended nationally. So 30% of ladies nationally did not attend for their breast screening.
Do you think, ladies, it could be down to possibly fear?
Absolutely.
Denial? Fear?
Yeah, definitely fear. I mean, we're all busy. We're all out doing things. Maybe it's one of those things that you think, I'll do that later, and don't get around to doing it. But yeah, the importance of it can't be underestimated, really.
Oh, no.
But yes, fear is there. And just to reassure, it is scary and it is a frightening thing to go through. But the positives absolutely outweigh that negative.
Yeah, I'm sorry, I was a bit stunned by those figures just then.
And in Medway, again, we said that out of the recalled 1,043 ladies to assessment, and out of that 1,043, we diagnosed 233 cancers. So that's for breast screening in the Medway, Dartford and Swale area.
That was for last year.
For last year, yeah.
25, yeah. Wow. Oh,
and then
God.
Out of that figure, so that's through the National Screening Programme. And then, so in total, for last year, for 2024, we had just under 500 patients diagnosed with breast cancer. So we're looking at just over a quarter for patients that are diagnosed through screening. Mm-hmm. So again, it just really shows the importance of this.
Oh, yeah, it emphasises the need to do it, doesn't it?
Yeah.
God. And at the end of the day, this is free to us.
Yes.
It's free.
Yes.
Yeah, you don't have to pay for it.
Yeah.
It's something that the NHS provide. And when I get to the age of 70, which I'm cruising on up to, I will be coming back because it's important.
Yeah. Yeah.
It is.
It's important.
We have
we are.
a very supportive team, not only with the nurses, but with the doctors, the radiologists,
Radiographers, our office team.
Yeah.
Yeah, absolutely.
It's a good team to work for. We're all very supportive.
I can tell by your dynamics that you're a bonded team.
Yeah.
And you've been in the hospital a long time as well, haven't you? So you've got years of experience, which is fantastic. Can I ask you one last question, ladies?
Yes.
Please do.
Okay, ladies, what message would you like to leave with the listeners today about breast health awareness?
So, going back to what both Tracy and myself have said at the beginning is don't wait to seek medical advice. If you find anything that's not normal for you, then again, go and see your GP to be referred in. Please attend the National Screening Programme. As you've said, Shirley, it's free. We don't pay for it. The benefit is the NHS. Undertake regular self-examination so that you get used to what your body is like, and think about lifestyle adjustments, regular exercise, try to reduce your alcohol intake, maintain a healthy weight, try to reduce smoking, or if you can, stop completely.
Sound advice, Cathie. Tracy?
Yeah, just really to reinforce what Cathie said, really. And just being breast aware and attending screening saves lives. And that's a really important thing to remember. The earlier that we can detect a cancer, the better the outcome. And just that there's always someone to talk to. Breast Cancer Now, Macmillan are fantastic resources. And we're always around. The Macmillan team, the breast unit, pick up the phone and give us a call if ever you want to chat with anyone.
Yeah.
Can I ask a question? Because you're just along the corridor. If somebody was really concerned, could they just walk in?
Unfortunately
Not,
not.
no.
Because quite often, certainly in the breast unit, there could be maybe 4 or 5 clinics all running at once. So sometimes when patients walk in, it could be jam-packed with patients. So it's difficult to have patients just attend ad hoc because there's all different types of clinics running.
Yes, yeah.
So
We can't always
unfortunately-
guarantee that we'd have an appropriate member of staff there either.
Yeah,
So the best
sure.
thing to do is give us a call and we can always phone you back and have a chat and arrange something.
Yeah.
That's really, really reassuring to know. Well, thank you so much for joining me here at Hospital Radio Medway. It's been a privilege to hear from our wonderful guests today, Cathie and Tracy, Macmillan Breast Cancer Team and Breast Screening Team. Did I get that right?
Yeah, perfect.
Right, please remember October is Breast Cancer Awareness Month. So I guess the message from you two ladies today is check your boobies, isn't it?
Yes.
Absolutely.
Check your boobies.
Well, thank you ever so much, ladies. It's been
Lovely.
a
Thank you.
pleasure and very enlightening. And thank you. I will follow that routine.
Thank you very much. Thank you for your time.
Thank
Great
you.
stuff.
To listen to more episodes or find links to all of our programmes and videos, visit hospitalradiomedway.co.uk. You've been listening to Chatterbox.